Hello everyone, my name is Neher, and in this video I will be discussing ethical issues in research surrounding communication in allied healthcare fields. We'll look at the principles of scientific communication, the ethical implications in human research, and how healthcare professionals can communicate effectively and professionally in both research and clinical practice. And here is our outline for today's topics. We got ethical issues in surrounding healthcare communications with the focus of ethical implications, communication in research, and professionalism. The audience is the GCU students, which are allied health professionals. Principles of scientific communication. Scientific communication is based on honesty, accuracy, and transparency. It involves sharing data and results clearly so that findings can be verified and built upon others. So we got honesty, objectivity, clarity, and accountability. For instance, when publishing research on a new patient communication tool, results should not be exaggerated or selectively reported. The importance of ethical communication in research. It helps build trust between researchers and participants, ensures informed decision making, prevents misinformation and protects participants' rights, and strengthens credibility of the scientific community. Ethical principles in human research. When research involves human participants, ethics must come first. Allied health professionals must respect the principles of informed consent, beneficence, justice, and respect for the people. Informed consent must be voluntary participation with the understanding that they can leave at any time, which usually is like a huge consent form, probably 20 plus pages. Beneficence, which is maximize benefits and minimize harm. So we can't put people through a bunch of harmful like drugs that are going to kill them. And justice. They need fair treatment and equitable selection. So usually that is when one person signs up, they're usually first on the list. And so it's not like choosing people based upon their race or anything else. And then respect for the people. Honor their dignity, privacy, and autonomy. Common ethical issues in communication research. Communication plays a major role in ethical research. Problems often arise when researchers fail to communicate risks, misinterpret results, or use language that misleads participants. Confidentiality is also another concern, as health professionals must protect patient data when sharing results. One way they do this is by sharing their results, but only putting their first and last initial and then a random number. And that's how they protect patient privacy. Transparency with both colleagues and the public helps prevent misinformation and supports evidence-based practice. So a couple things I have on the slide that are important is misleads or incomplete disclosure, breach of confidentiality, which I told you guys how they usually combat that, bias reporting or selected publication, and the lack of transparency with funding or conflicts of interest. Effective communication in allied health practice. Within the scope of practice, healthcare professionals should communicate respectively and clearly with patients, families, and colleagues. So a bunch of ways we can do this is use plain language and active listening, apply the SBAR situation, background assessment, and recommendation. So this one is particularly used a lot within patient care transfer. So a nurse to a nurse will use the situation, tell them the background assessment recommendation. Here's an example of like an EMS one going to a nurse in a hospital. So I have a 62-year-old male with a chief complaint of a headache. His background is he smashed his head into the ground while skateboarding. Assessment reveals a contusion, and his recommendation might be a hematoma, put an ice pack, maybe surgery if he has a brain bleed. And we need to be culturally sensitive and patient-centered because some cultures definitely have some sensitive background to it, and we need to encourage collaboration and respect. Professional written communication. Effective written communication is just as important. Whether writing research summaries, professional emails, or patient documentation, allied health professionals should use formal tone, correct grammar, and concise language. All communication should protect the confidentiality and reflect ethical standards. In conclusion, ethical communication in research and practice is about honesty, respect, and professionalism. By upholding these values, allied health professionals not only protect participants, but also strengthen the integrity of the entire healthcare field. And here are my references I used.